Hey everyone, and welcome back to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled, An Overview of Dupuytrens and What to Look Out For. Have you recently noticed a lump in your palm? Or maybe your doctor is concerned you have something called Dupuytrens, and you're confused about what it is or even how to pronounce it. About 1 in 20 people will develop this condition, typically in their 50s and 60s. Here's your introductory guide to help you understand the basics of this condition called Dupuytren's disease in the hand. So you may be asking, what is Dupuytren's disease, and what is Dupuytren's contracture? Dupuytren's disease is a general term for a soft tissue disorder of the hand. Dupuytren's contracture is a more advanced and aggressive subtype of Dupuytren's disease that results in stiff contractures of the fingers that often need intervention from a hand surgeon. So what's the disease? In its simplest form, this disease involves fibrotic changes to the palmar fascia. Translation: a thickening of the tissues under the skin of your palm. The palmar fascia is a thick layer of connective tissue just beneath the skin in the palm. A similar layer exists on the soles of the feet, giving these tissues extra strength to handle repetitive daily tasks such as heavy gripping and walking. In some people, the disease advances to a Dupuytren's contracture, where these fibrotic tissues will actually contract and permanently shorten along the lines of repetitive mechanical stress within the hand. What are the symptoms of Dupuytren's? Most people will first notice Dupuytren's disease in the form of a small nodule or small palm mass, most commonly over the palm crease at the base of the ring or the small finger. These can be mildly tender or annoying, but typically they are not painful. Over time, these nodules can evolve into cords or linear masses of thickened tissue. There's an image in the article attached, and these exist in the palm and extend towards and away from the fingers. In those who develop a Dupuytren's contracture, it's these cords that eventually become contractile, resulting in an inability to straighten the finger. So what causes Dupuytren's? Even with our best and most up-to-date understanding of the disease, the root cause still remains unclear. Many forms of Dupuytren's are inherited, meaning you will meet families where multiple members all develop Dupuytren's later in life. But the most common form is still sporadic, meaning it happens out of nowhere. And the worst part, there is no cure. We can certainly treat aspects of the condition, but we cannot cure it. Additionally, there is no treatment for Dupuytren's disease itself. We have treatment options for Dupuytren's disease only when it becomes its more aggressive form and advances to involve a contracture. Even in this circumstance, the treatment options are to address the contracture, not the underlying disease. We will get into the specifics of Dupuytren's contracture treatment in future posts. In fact, it's for this reason that we unfortunately will often see recurrence of the contracture and expansion, which is evolving new disease in untreated areas, after a previous treatment. So why do we know so little and why is there no cure? It turns out that there are a few reasons why Dupuytren's disease has proven difficult to study in the research lab. First, there's no good animal model on which to base experiments. Second, there's no unique biomarker like a gene test or a blood test for the disease. And while it appears to have strong gene traits, a consistent gene pattern has not been identified. Rather, it appears to be a complex interplay of multiple genes and environmental factors that eventually lead to symptoms. So who gets Dupuytren's? Most will develop this in their 50s and 60s. The disease is far more common than you might think, appearing in up to 21% of Caucasian males in Western countries by the age of 65. Female patients lag behind their male counterparts by about 10 to 15 years, meaning we typically see this condition more frequently in men than women. In those who develop the disease, the most pressing question that they will ask is whether they will develop a finger contracture. Fortunately, the answer is only about 1 in 5 patients who have the disease go on to experience a hand contracture during their lifetime. Because of this complex interplay among genes and the environment that leads to the development of the disease, it progresses unpredictably and with variable severity. Some patients very quickly develop very severe contractures, while others will grow one painless nodule in their hand and show no further symptoms. I'm asked a lot if Dupuytren's disease is a cancer. Dupuytren's is not dangerous. This is not a malignant or a cancerous growth, and it does not spread from the hands to other parts of the body. However, it is possible to have a severe form of the disease that causes similar fibrotic fascial thickening to concurrently present in other parts of the body, such as the feet or the genitals. I also get asked a lot if my Dupuytren's will get worse. Can we predict it? The answer is sort of. There are variables known as a diathesis factor that have been shown together to predict disease severity. No single factor means that your disease is guaranteed to be aggressive, but instead, the more of these variables you have, the more likely your disease will be an aggressive form. Aggressive disease typically will 1. Progress faster, and 2. Be more likely to return after treatment by a hand surgeon. The factors involved in a Dupuytren's diathesis include having an age of onset under 50, Dupuytren symptoms in both hands, nodules that grow on the back of the knuckles, nodules that develop elsewhere in the body beyond the hands, Dupuytren symptoms in close family members such as parents or siblings, male patients, involvement of the thumb, or involvement of 3 or more fingers. Notice that the severity of the finger contracture is not actually a predictor of aggressive disease. So some takeaways from today. Dupuytren's disease is a common, often inherited condition of the hand that appears later in life and has variable degrees of severity. About 1 in 5 patients with the condition will go on to develop a hand contracture associated with the disease, and most of these do necessitate treatment. Dupuytren's is not a cancer and is not a dangerous condition. However, it can severely limit hand function if the contracture gets bad enough. As you can see, Dupuytren's is a complex disease that manifests in many ways, from benign bumps in the hand all the way to severe and debilitating finger contractures. In future articles, we'll discuss the treatment options for different stages and different types of Dupuytren's contracture, including newer non-surgical treatments that have sort of revolutionized the field over the past 10 to 15 years. That's all for today. Thanks for being here. We'll see you next time.